hand hygiene, privacy. Hi, my name is Natasha. I'm going to be your student nurse today. How are you? Good. Okay, so today I'm going to do a nasogastric tube insertion and removal. It will take about 10 to 15 minutes and it'll involve a little bit of touching. Is that okay with you? Thank you. All right, so before I begin, do you have any questions for me? No? Okay. Can you state your name and your date of birth? Check the armband. Okay, thank you. Do you have any allergies? No? And in a scale of 0 to 10, 10 being the worst, are you experiencing any pain at the moment? No? Okay. So this is going to be a clean technique procedure. I'm going to go ahead and put my clean gloves on. So I've already assessed the patient's bowel sounds, and I heard hypoactive bowel sounds, which is good. I'm going to go ahead and raise the bed on my hip level. I'm going to position the patient in high Fowler's position. I'm going to make sure that he's comfortable. I'm going to lower the side rails down. So first thing we need to do before I insert the NG tube is to measure the tubing first to know how far I'm going down. So I have here my saline sump with air tube. I'm gonna go ahead and open this away from me. Okay, so I'm gonna start measuring from the patient's tip of the nose around his ear and all the way to the xiphoid process. Okay, so I'm gonna go ahead and mark that measurement with a tape. I'm gonna make sure that I'm not wrapping the tape around the tubing so I can easily remove it later. I have 42 centimeters. So I'm gonna go ahead and put that aside. Okay, I'm going to put a drape across my patient's chest here. I'm gonna make sure I have all my supplies here. So this is gonna be my emesis basin. I'm gonna put it close to, in front of my patient, just in case he becomes nauseated when I'm putting the tube in. It will catch all the secretions. Okay, and so I also have my irrigation syringe and bottle. This is gonna be, I'm gonna pretend that this is my irrigation syringe, and the measurement would be in mLs. And I have my pH paper here with packaging. And this is gonna be my tongue depressor. And I'm also going to get a maybe 2-inch of tape, and I'm going to make a slit in the middle, just like this. Put it aside. And I'm gonna get my saline sump. I'm going to attach the irrigation syringe. Okay, and then I'm also going to put water with a straw right next to my patient. So when I ask him, I want him to start to sip water to help steer the tube to the esophagus when I'm doing the procedure. So before I insert the tube, I'll ask the patient, have you had any broken nose? How about any nasal surgery? No? Okay, how about a deviated septum that you know about? No? Okay, thank you. So I also have my pen light. I'm going to use this. And I'm going to ask my patient to tilt his head back, and I'm going to look into his nostrils to see if there's any obstruction. So I didn't see any obstruction. Okay, so I'm gonna ask you to cover one nose for me and breathe in and out. Yeah. Okay. Any difficulty? No? Okay. Can you do it on the other side? Breathe in and out. Okay. Any difficulty? No? Okay, so it looks like both nares are open, and I'm going to use the right nostril. Okay, I'm gonna go ahead and grab my saline sump. I'm going to lubricate the tube generously for easy passage, and then I'm going to put my hand gently behind my patient's head while his head is tilted back, and then I'm gonna start inserting the tube into the back of his throat. Okay, so once the patient gags or choke, I'm going to tilt his head down towards his chest as I insert the tube up to the 42 centimeter mark that I got. Okay, so I'm gonna ask you to drink for me. So drink, 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 drink. Okay, so that is the 42 centimeter mark. I'm gonna go ahead and get my tongue depressor. I'm gonna ask the patient to open his mouth. I'm gonna check his tongue if the tube is coiled, and then I'm also gonna use my pen light to check his mouth and around the tongue. Okay, so it looks like the tube is not coiled. I'm gonna go ahead and tape the tubing on his nose. Okay, and then I'm going to wrap this on the side. Okay, now to make sure that the tube is in place, I'm gonna go ahead and pull out a little bit of gastric contents, about 5 ml. I'm going to detach the irrigation syringe. I'm gonna make sure that I'm holding up the tube so the gastric juice won't come out. I'm gonna drop a little bit of the gastric juice in the pH. Okay, I'm going to put back the irrigation syringe to the tube. Now I'm going to compare the pH paper with the package. So the gastric acid pH of the stomach is supposed to be between 3 to 4. So the patient's pH is 3.3, so which is okay. So I'm gonna make sure that I put back the gastric contents in my irrigation syringe. Okay, now I'm going to detach it, and I'm going to draw up 20 ml of air. Okay, and I'm gonna go ahead and irrigate 20 ml of air to make sure all the gastric contents are out of the tube. Okay, I'm gonna go ahead and detach that, and I'm going to get my plug back in. I'm going to close the blue port. Okay, so I'm going to remove the drape around my patient, or across my patient's chest, and I'm going to secure the tubing on the gown where the patient can still turn his head side to side without pulling onto the tube. I can use a safety pin for that. I'm also going to attach it to the top of his gown so nobody can miss that he has a tube in. Okay, so I'm gonna go ahead and remove my gloves, perform hand hygiene. I'm gonna lower the bed down. I'm gonna raise the side rails up. I'm gonna make sure that the brakes is on. I'm gonna discard everything, all my supplies per policy. Before I leave, is there anything else I can help you with? No? Okay, thank you. So now the patient is ready for x-ray to confirm the placement of the tubing. So I'm already done with my NG insertion. I'm gonna go ahead and document it. Okay, so going straight to the NG removal, gonna grab all my supplies. So I have a tissue and my irrigation syringe. So patient has had his NG tube for a few days now, and the doctor has ordered to remove it. I've already introduced myself. I already provided privacy. I identified the patient with 2 identifiers. I already explained to him what I'm doing. Patient has no allergies and in no pain. I'm going to raise the bed to my hip level. I'm going to place the patient to high Fowler's position. I'm going to perform hand hygiene, and I'm going to put clean gloves on. So first, I'm going to take the tubing off the patient's gown. So if the tubing is connected to anything, I'll make sure that I'll clamp it off. And then I'm going to irrigate about 20 ml of air to make sure that anything in the tube goes to his stomach. Okay. Okay, so now I'm ready to remove the tape off on his nose. And I have my tissue here ready. Okay, before I remove it, I'm gonna ask you to hold your breath for a couple of seconds, okay? And then I'm gonna start removing it. So 1, 2, 3, and out. Okay, so I'm gonna discard all my equipments per policy. I'm gonna remove my gloves. I'm gonna perform hand hygiene. Okay, how are you doing? Are you doing okay? Are you comfortable? Okay, thank you. So I'm gonna go ahead and lower the bed down. I'm gonna raise the side rails up. I'm gonna make sure that the brakes is on. And is there anything else I could help you with before I leave? No? Okay, here's your call light. Let me know if you need anything. So I'm done with my NG removal and insertion. So I'm gonna go ahead and document.